I'll try to do my best. So it's an update about NAIN, and we all know that it's a common cause of vision loss in the elderly population, presenting generally in 6 to 7 decade, and is caused by the occlusion of the short posterior ciliary arteries. There are certain ocular risk factors like optic nerve head drusen, like optic nerve cup, a small optic nerve head along with a small cup causing a structural crowding there. Then can be systemic association like diabetes, hypertension, hyperlipidemia, cerebrovascular diseases, and hyperhomocystinemia. It generally presents as sudden onset, painless loss of vision, monocular loss of vision noticed on awakening. So that's a classical history, the classical complaint patient will come up with, that on getting up, I realize that I have no vision in one eye. Systemic symptoms are usually absent. Around 30% of patients may have a normal or slightly reduced visual acuity. However, most of them will have moderate to severe vision loss. Visual defect will be typically in form of an inferior altitudinal defect, although superior altitudinal defect can also be seen. Then there can be central or paracentral scotomas, which are very rare. Quadrantic and arcuate defects, I would say, are more common. Dyschromatopsia is seen as with any other optic neuropathies. The kind of disc swelling we see, which can be segmental or global depending on the severity of ischemia, the disc swelling. This kind of disc swelling resolves over a period of 3 to 6 weeks, and eventually the pallor ensues. The 5-year risk of other eye involvement is seen in around 15% of cases and may present as pseudo-Foster-Kennedy syndrome. As far as treatment is concerned, there is no definitive treatment in spite of multiple treatment strategies that have been tried in these studies. So this is a case of NAIN where you can see that there is a classical small disc over here with edema, which is leaking on fluorescent angiography. The other eye is also very small, crowded disc, suggestive of disc at risk. So what is new in our understanding of this particular disease? Number one, now because of the advent of OCTA, we have realized that there is definite and ischemic pathology involved, and both peripapillary as well as macular vascular densities have been shown to be decreased in cases of NAIN. And multivariate logistic regression has shown that there's a correlation between higher levels of RDWs and NAIN that may be associated in this case. So what is new in the treatment? As far as treatment is concerned, as Sir was saying that steroids are still controversial if it's a typical case of NAIN. However, we may never be sure that whether it's an NAIN and inflammatory. So whenever in a doubt, please do neuroimaging. Please rule out the atypical optic neuropathies, particularly MOC positive and NMO positive optic neuritis. And steroids may have some role in those cases, but definitely not so beneficial role in cases of ischemic optic neuropathies unless it's an arthritic ischemic optic neuropathy. So the multiple studies have been done to note the impact of the steroids on the outcome, and these studies have shown that the steroids may have some beneficial effect on the disease process. However, there are equal number of studies to show that the steroids do not offer any added advantage on the recovery of vision in cases of NAIN. Then there are adverse effect of steroids also, which are reported in these cases and therefore should be used only with caution wherever indicated. Novel treatment in form of this particular molecule QPI1007 was an siRNA and has been tried, but however no much benefit has been observed in phase 2 studies, and therefore the entire multicentric study was discontinued. Other molecules in form of retinol ROCK inhibitors, which have the neuroprotection property, have been used in this condition, but still it's in the research stage and no clinical implications have been noted as of now. And therapeutic intervention, as this particular study has shown, meta-analysis has shown that any form of treatment, whether steroids, dopamine, erythropoietin, have not shown any kind of beneficial effect over the placebo therapy or over the observation in patients of NAIN. Now as I presented earlier also, there are a lot of, COVID related complication, and NAION is one of them because of hypercoagulative state, hypoxia, and maybe also because of chronic proning. NAION have also been reported after the vaccination. Thank you.
Thank you, Dr. Swati. And